Operating room fire prevention, practical pointers for patient protection. Operating room fires are devastating events that occur at least 650 times annually. These never events result in at least 2 patient deaths per year and not only affect the patient but also impact the entire operating room and can lead to economic and legal issues for the hospital. The Joint Commission considers OR fires a sentinel event, defining it as fire, flame, or unanticipated smoke, heat, or flashes occurring during an episode of patient care. Surgical fires are notably increasing in frequency, according to a recent Sentinel Event Alert published by the Joint Commission in 2023, and are a source of an increasing number of surgical liability claims. This change is echoed by an increasing number of surgical device-related fires. So how do we prevent OR fires? Most are preventable by appropriately and safely managing electrosurgical equipment and maintaining situational awareness of potential risks. In this video, we will discuss common mechanisms of operating room fires and electrosurgical injury and how to minimize fire risk. What causes operating room fires? A fire occurs when heat, oxygen, and fuel, known as the fire triangle, come together in the right proportions and under the right conditions. Let's assess 3 critical elements. Heat. Surgical energy, called electrosurgery, is the ignition source for most surgical fires involving the patient. The most common form of surgical energy is monopolar radiofrequency energy, often referred to as the BOVE. The BOVE converts electromagnetic energy into thermal energy, and it is the heating of tissue or the energy device itself that serves as the ignition source for the fire. Oxygen. Oxygen is required as the oxidizer and makes fire burn faster and stronger. How the anesthesia provider delivers oxygen to the patient is of utmost importance. For example, open delivery of oxygen via a face mask poses a more serious threat to the patient than a closed system via intubation. Fuel. Fuel is all around us, making it the most difficult variable to control. Anything can be a fuel source, from the surgical drapes, patient prep solution, gauze pads, and surgical towels, to tissue char and even patient hair and skin. How to prevent fires. Fires can be easily prevented, so how do we do that? When using electrosurgery tools, remember ACT, adjust, clean, tidy. Adjust the electrosurgical unit to the lowest possible setting that will achieve the desired surgical effect. When higher than necessary voltages are used, higher temperatures are created and the chances of arcing are increased. Clean the electrode tip frequently. As eschar builds up on the tip, electrical impedance increases and this can cause arcing, sparking, or ignition and flaming of the eschar. When cleaning the electrode, the eschar should be wiped away using a sponge. A scratch pad can only be used with the standard BOVE tip. A Teflon BOVE tip will be damaged by the scratch pad and increase risk for fire. Tidy. Holster the electrosurgical instruments when not in active use. Ensure BOVE tip is well seated in the pencil. Never wrap electrosurgical cords around metal instruments. Even the insulated cord conducts electricity and can lead to patient burns. Instruments should never be placed on drapes. A hot instrument placed directly on a drape can burn a hole and could reach the patient. Light source and cord management. Proper management of light sources and cables is vital as 15% of peri-procedural fire incidents are related to light sources. Even momentary proximity between an illuminated laparoscopic light lead and a surgical drape can cause skin burn. Keep the light source at the lowest brightness setting that allows for safe identification and dissection during the case. Always return the scope and light cord to the Mayo stand or other sterile location when not in active use. Never leave the scope and light cord on the patient. Keep illuminated light cords away from drapes, patient skin, personnel skin, and any flammable material. Other important considerations. Alcohol-related fires. Alcohol-related fires can cause serious injury. Alcohol-based prep solutions such as ChlorPrep burn readily in room air, and the fires can be difficult to see due to their faint blue flames masked by blue surgical drapes. Best practices include allowing enough time, more than 3 minutes, for alcoholic skin preps to dry, avoiding pools of alcoholic skin preps, discarding alcohol-based prep outside of the OR, and avoiding prep placement on hair unless adequate time has been given to dry, which can range up to 60 minutes. Wet surfaces. Never operate electrosurgical equipment while standing on a wet surface. Keep the foot pedal dry, especially during procedures where water may be on the floor, such as during a hysteroscopy, cystoscopy, or following abdominal irrigation. Dwell time. Prolonged on time of the active electrode results in higher temperatures, higher risk of spark or fire formation, and unintended thermal injuries. Limit on time to 30 seconds and provide at least 10 seconds off time before reactivating. Limit the space between the electrode and the tissue, as increased distance increases temperature, arcing, and fire risk. In conclusion, operating room fires are preventable with clear communication, appropriate education, and thorough risk management. Every member of the OR team should feel ownership and responsibility for fire safety. We encourage you to be vigilant and thoughtful in your operating room techniques to increase safety for your patient and your healthcare team.